Thank you, Dr. Casey. Madam Chair, members of the board, thank you again for another opportunity to provide you an update of the COVID-19 situation in Chesterfield County. Next slide, please. So how many people are sick? These numbers, of course, are changing daily. Worldwide, we're nearly at 2.5 million for total cases, with 179,000 deaths globally. In the United States, we have 825,000 cases and just over 45,000 deaths. In Virginia, the VDH website, which has not been updated today, indicated 9,630 cases and 24 deaths as of yesterday. And in Chesterfield County, we recorded 354 cases today, with 7 deaths noted on the VDH website. Next slide. Thank you. For COVID-19 outbreaks, outbreaks are defined as 2 or more cases in a given congregate setting. I wanted to take some time to talk about outbreaks in long-term care facilities, which are naturally places where we want strong protective measures in place. There are 3 county long-term care facilities with active cases that fit the criteria for having an outbreak. There is one more facility which met the strict definition of an outbreak several weeks ago, but has no active cases. These facilities house our most vulnerable, and addressing infection control of a highly infectious disease in a congregate setting can be very challenging. I want to commend all staff members of our long-term care facilities as well as other congregate settings for the very difficult work they are doing under very trying circumstances. They have difficult jobs to begin with. So when public health hears about a case, it's typically a week and a half, sometimes 2 weeks between when the person was actually exposed and when health departments are notified. This is due to a couple of important factors, which include how long it takes for a person to develop symptoms, which can range from 2 to 14 days, but seems to average around 5 to 6 days. It also depends on how long it takes to get test results back, which can add an additional 2 to 7 days, depending on the person's lab. So by the time we hear about a case, it's very likely that others in the facility have been exposed in the interim. I think most places have been vigilant and are putting strict frontline infection control measures in place as we're learning more and more about best practices. The challenge is that once a facility learns about its first case, they've been playing catch up for a while, and their goal then is to contain and control the spread through strict infection control practices, knowing that they could see additional cases come in from the initial or even secondary exposure. So even after putting in strict infection control practices into place, it could take another week or more to see how well the mitigation efforts have worked. All of this means is that problem onset, action, and awareness of results can be separated in time by sometimes 3 to 4 weeks. This can make stopping an infection at its source a very hard task. One of the best measures to adopt is simply to treat everyone as if they have the infection and implement strict infection control practices all of the time. So the 3 facilities with positive cases that we've been working with have been good about implementing strict infection control measures. There are additional cases in a facility, we consider the need for and coordinate additional focused testing, and then continue with regular follow-up and monitoring. The State Office of Epidemiology is reviewing broader testing strategies, and we're expecting guidance on best practices very soon on how to implement broader scale testing appropriately. Next slide. So there have been improvements in private sector testing capacity and access that have resulted in more lab testing capabilities becoming available and more testing being done by larger private practice groups like urgent care centers. There are, however, reports of supply shortages, including test swabs used for collecting samples. All this to say that although things are slowly improving, we're still not where we need to be with regard to testing. There is, however, an acknowledged need to improve broader scale testing capabilities in communities, if for no other reason, simply to understand the disease burden better. This has led to the creation of a state task force to examine testing capacity and develop clear guidelines, coordinate resources, and help make decisions about where community-based testing would have the most benefit. How to best conduct such testing is still an open question as well. but the potential value includes providing better data to understand the scope and impact of certain communities, especially if inequities are a consideration. Next slide, please. There's still strong evidence from statewide data that the social distancing strategies are working. As the number of new cases stabilizes and then decreases, restrictions will begin to lift and people will begin to come together again. When this will happen and the manner by which it will be implemented are yet to be determined, but when it does, one of the essential tools of public health, contact tracing, will become more important than ever. Contact tracing essentially means locating individuals who are exposed to someone with an infectious disease like COVID-19 and determining their potential risk for having contracted the disease. If the risk is high, these individuals are asked to self-quarantine for the length of time it typically takes for the disease to appear after someone has been exposed to it. In case of COVID-19, it's 14 days. This way, we remove potentially infectious individuals who might expose others and therefore continue the chain of transmission. Contact tracing has been a cornerstone of what the public health system has been doing from the very beginning of the pandemic, and it will become even more important as social distancing measures relax and people come together again. The goal is to prevent a secondary outbreak that would likely result in a return to strict social isolation measures. Measures like self-quarantine for some time until the COVID-19 case numbers diminish to minimal levels. Next slide, please. So until then, we're still working to flatten the curve. And as a reminder, here's a list of some essential practices that we all must do to reach the goal. Wear a face covering when social distancing is difficult. Adhere to social distancing practices. Remain home if you're among those most vulnerable. Practice the personal protective measures like washing your hands with soap and water often. Next slide, please. Just conclude with some reminder slides. Here are the health district numbers that county residents can call if they have COVID-19 related questions. One is for general questions, the other is for healthcare providers. The Virginia Department of Health offers a similar service. Next slide. I'll end with my usual list of good information sources, all of which are kept up to date. With that, I conclude and I'm certainly open for any questions you might have.
Board members, do you have any questions for Dr. Samuel? Dr. Samuel, just thank you again. Thank you for everything you and your team are doing, not only to serve our community, but for keeping us up to date on all of this information as we're all collaboratively and collectively in this.
Thank you, Ms. Kelly.
If now, could Chief Center just give a brief synopsis from his perspective, please?
Thank you, Dr. Casey. Well, good evening, Madam Chair, members of the board, and Dr. Casey. We are now deep into week 6 of the county's response to the COVID-19 pandemic. The county's Emergency Operations Center, or EOC, continues to function virtually each day, and over 200 county employees and other stakeholders are working together to coordinate the county's response and meeting the needs of our community. PPE resupply continues to be a major focus of the EOC to ensure that our first responders and other employees who have contact with patients or clients have the protection they need to safely perform their jobs. We continue to work with the Virginia Department of Emergency Management, or VDEM, on supply needs. Some supplies have been trickling in recently, both from our contract vendors and from VDEM, and we continue to receive small quantities of PPE through donations from businesses and individuals in the community. We've established a dashboard that tracks PPE supply and burn rates in real time so that we can shift supplies between departments as needed before any one department becomes critically low. We also continue to pursue alternatives for the decontamination and reuse of PPE, particularly masks and eye protection. Another important area requiring our attention is support of our long-term care facilities, such as nursing homes and assisted living facilities that have been hit particularly hard by the virus. The Department of Citizen Information and Resources, and in particular the Office of our Senior Advocate, has reached out to all of the long-term care facilities and established lines of communications to share information and provide support as needed. Fire and EMS Department and CIR are supporting the efforts of the Chesterfield Health District to establish a task force style approach to issues that may emerge in any of our long-term care facilities. Finally, we continue to monitor demands for pre-hospital services such as EMS, and we collaborate with the hospital systems that serve Chesterfield County. Daily call volume for fire and EMS remains at or below normal levels and has been as much as 26% below normal levels in recent days. The two major hospital systems serving Chesterfield, as HCA and Bon Secours, have noted their patient census remains below normal and only 10% of their ventilator capacity is currently being used. HCA in particular has indicated that over the past week, they have seen the number of COVID positive patients plateau, and they expect their peak resource demands to be this week, with a sharp drop off in patients by May 1 based on modeling they are performing. Thankfully, the available dashboards on hospital capacity suggest that there will be more than adequate supply of hospital beds, ICU beds, and ventilators in Virginia during peak resource demands. This has prompted the state to place on hold plans to establish alternate care facilities at various locations, including the Greater Richmond Convention Center. Madam Chair, that completes my report, and I'll be happy to answer any questions the board may have at this time.
Any questions from board members? Again, I thank you. I thank you, Chief Senator, and thank you to all of our team, not only for the updates that are very timely to us, but also for the response that we see our citizens are getting, and we can't thank you enough.